So we're going to look at some statistical considerations when conducting our research. Up front, I want to tell you, I understand probably none of us are statisticians, and the biggest rule here is before you start your research, it's important to consult with a statistician to make sure that not only will you be using the correct statistical methods when analyzing your data, but also you'll be collecting your data in a way that allows it to be analyzed appropriately. So, as we said, in this session we're going to specifically look at statistical methods that you might use for analyzing your data. A few basic ideas about data entry. First thing is, when you're entering data, keep the data that you enter as raw as possible. So for example, you may be looking at some phenomenon, chest pain or shortness of breath or depression in relation to age. And you may have in your mind that you will group ages into more manageable age groups. However, in the beginning, just collect the age of the patient. The reason for this is that you may have an idea how you want to divide your ages up, and then after you finish the research, you realize you should have divided the ages up differently. If all you collected were age groups, then you can't do anything about that. But if you collected the actual age of the patient, you can divide them into any age groups you want when you reach this stage of data analysis. Think about missing data. So, in most research, some of the data will not be entered by the respondent. It's not good practice to leave it blank. You need to put a code in that represents missing data. And the reason for that is that in terms of data analysis, the data analysis program may deal with missing a blank box differently from a box that tells you when the data is missing. But remember, sometimes questions are not supposed to be answered. So for example, if you have a question asking, do you have pain? The answer may be yes or no. And then you have a follow-up question. If yes, how severe was the pain? Now, you only want the people who said yes to answer question 2. So if that is just left blank, then you're going to get misleading readings, because does blank mean the patient didn't want to answer, or does blank mean that the patient answered no and therefore should not have answered? So you need to think about how you code for all of this. For example, putting in a code for not applicable. Then think about questions that are obviously incorrect. So somebody misenters the blood pressure 189 over 324. That can never be a human blood pressure. In that situation, it's best to recode such incorrect data. Before you start your analysis, recode such obviously incorrect data as NRO, not recorded. So let's just talk our way through some data coding here. So you ask a question, how satisfied are you at the treatment given? And you have these 5 choices. Now, how are you going to enter this into an Excel spreadsheet? How do you account for people who did not answer? And how do you account for people who did not get treatment? So 2 things here. One is, every time you look at this, one column on an Excel spreadsheet should contain choices that are complete, well-defined, and mutually exclusive. So in other words, every single response in that column should have a code for it. That's the complete part. Mutually exclusive. You shouldn't have a situation where any response could be coded using more than one of your options. And well defined. So you must know exactly what any code means. So that's okay for this. You're going to ask these people this, and you're going to ask them to choose one of these options. But to be complete, you need to think about people who did not answer, not recorded, a code for that, and then maybe people who didn't get treatment, so it's not appropriate for them, so are not appropriate section as well. What about this one? Do you suffer from any of the other chronic illnesses? And you give choices here. So the thing is, look at this one. These are not mutually exclusive. Therefore, you can't use one column on an Excel spreadsheet to record all of this. You're going to have a column for each of these choices. Diabetes, yes, no. Hypertension, yes, no. Renal disease, yes, no. Heart disease, yes, no. What about if they had other conditions? Then you need a column to say other, yes, no, and then maybe some free text for them to tell you what they had. If somebody just doesn't answer at all, that's a problem. You can't assume they don't have any of these conditions. Ideally, this needs to be recorded as coded as not recorded. They did not answer your question. So these are just some practical issues regarding data collection. When you come to analyzing data, in any research there are two sections to this. One is the descriptive data. So you're going to look at your entire study sample and talk about them. What age were they? What was the gender breakdown? Ethnicity? Clinical status of the patient. And then secondly, you're going to actually, if it's a comparative study, compare different groups. And this is where we talk about statistical significance and p-values, etc. So this is an overview of the kind of statistical methods we might use. So for the descriptive data, you're going to have summary statistics for the whole population. What's the mean age or median or mode? Or a proportion, what proportion of patients have this characteristic? What proportion are male? What proportion are female? And then usually when we give a summary statistic, we give an indication of how much variation in that characteristic is there in the population, using things like standard deviation, which is used with if your summary statistic is mean, or interquartile range if your summary statistic is the median. And then when you're comparing data, you use one of the tests on the right hand side, according to what kind of data you're comparing. I'm not going to go into this in more detail. You can come back and look at the slide later on. And of course, as we said before, there is only one consideration. Consult with a statistician before you start your research. Okay, so that was just a brief introduction to statistical analysis for your research. Just to give you an idea of the kinds of things you need to think about. As I said before you begin your research, you need to consult with a statistician. If you have any questions, you can post them on the discussion board. So your worksheet task for this talk is to think about how you're going to analyze your data for your research. Think about what data you're collecting and if it is the right data, and when you are comparing groups, what is the right comparison. Our final lecture in the series is going to focus on ethical considerations.